Okay, ready?
Hello, my name is Amy.
I'm Leo.
And I'm Tiffany. Today, the research we're going to be discussing dives into the complex relationship between salivary diagnostics, periodontal disease, and systemic conditions like rheumatoid arthritis and inflammatory bowel disease. By understanding how genetics and environmental factors in the oral microbiome contribute to these conditions, we can appreciate the importance of early detection and innovative diagnostic tools. Salivary diagnostics is a non-invasive method for assessing disease risk and is at the forefront of preventative care, allowing for earlier intervention and better patient outcomes. Today, we will explore the complex nature between periodontal disease, its systemic implications, and how advancements in salivary diagnostics could revolutionize modern healthcare.
So I want to go ahead and discuss how both genetics and environmental factors influence the risk of periodontal disease, which this is a common condition that affects the gingiva and supporting structures of your teeth. So genetic predisposition, it plays a significant role in periodontal disease, which correlate with genetic factors like having a major impact in the risk of developing periodontal disease. So differences in immune response genes can make some people more susceptible. It's similar conditions with like rheumatoid arthritis and Crohn's disease, which recognizing these genetic risks can help identify those who have these conditions to do preventative care with them. Another factor would be environmental factors. So environmental factors, especially like smoking, these can also play a significant role. Smoking not only slows down wound healing, it also promotes bacterial growth, and which it could lead to a process called DNA methylation, which this process changes how genes are expressed and how they weaken our immune system, and it makes it harder to fight off infections and worsen periodontal disease. In addition to these factors, we also have the saliva testing, which offers a simple way to assess the risk of periodontal disease, and then you could do it more accurately as well.
So I
So
actually
today I'd
wanted,
like to shed some light on a significant, yet often underestimated condition called periodontal disease. Periodontal disease is not just an oral health disease, it's a complex inflammatory condition with widespread systemic implications. If left untreated, it can contribute to severe health conditions, including rheumatoid arthritis and inflammatory bowel disease, and even cardiovascular disease. However, advancements in salivary diagnostics have opened new doors for early detection and intervention, improving patient outcomes. Periodontal disease is a multifaceted condition caused by a complex interplay between pathogenic bacteria, host immune responses, genetic predispositions, and environmental factors such as smoking and poor oral hygiene. It starts with plaque accumulation, leading to gingivitis, which is an inflammation of the gum tissue. And if left untreated, this inflammation leads to periodontal disease, where the body's immune system becomes destructive and breaking down soft tissue and bone surrounding the teeth. So key bacterial culprits are going to be Porphyromonas gingivalis, Treponema denticola, and Tannerella forsythia. Those are also known as the red complex. These bacteria not only evade the immune system, but actively contribute to tissue destruction through toxins and enzymes. One P. gingivalis in particular has been associated with systemic inflammation due to its ability to disrupt the body's immune balance, potentially worsening conditions like rheumatoid arthritis and inflammatory bowel disease. So traditional periodontal assessments rely on clinical measurements, such as probing depths and radiographs to determine bone loss, which only really detects the disease after it has already occurred. However, salivary diagnostics presents a non-invasive, innovative method for early detection before the damage has already occurred. So saliva contains a wealth of biomarkers that can indicate the presence of periodontal pathogens, inflammation, and even tissue destruction before symptoms become clinically evident. So key salivary biomarkers that we're looking for are going to be pro-inflammatory cytokines, like interleukin-1 and interleukin-6, which are released in response to bacterial infections and contribute to inflammation. MMPs, particularly MMP 8 and 9, which degrade collagen and connective tissues, accelerating the periodontal breakdown. And then microbial DNA, so from the periodontal pathogens, which helps identify high-risk individuals before clinical signs appear. The impact of periodontal disease goes beyond the mouth. Research has shown a bidirectional relationship between periodontal disease and systemic inflammation. And those disorders, rheumatoid arthritis and inflammatory bowel disease, are a part of that. For instance, P. gingivalis produces an enzyme called PAD, which alters proteins in a way that triggers an autoimmune response, contributing to the destruction of the joints in RA patients. Similarly, disruption of the oral gut axis can create then inflammatory process known with inflammatory bowel disease. Help me. The future of salivary diagnostics. With further research and development, salivary testing can become a standardized tool for routine periodontal screenings, allowing clinicians to detect disease in its earliest stages and intervene before irreversible damage occurs.
Alrighty, so a little bit more on salivary testing or salivary diagnostics. It's something that has the potential to completely reshape or reconfigure the way we detect or monitor diseases. It may seem simple, but our saliva actually contains a lot of biomarkers reflecting things like inflammatory responses or different microbial changes in our oral cavity. So it's an effective tool to go ahead and diagnose early disease and for detection. Like we had briefly talked about, it's non-invasive, so it eliminates the needs for needles. It makes it a lot simpler to collect samples, and it's completely painless for patients. It allows for real-time disease monitoring, so it helps us track the progression of any kind of conditions or diseases our patients may be having. It enables for large-scale screening, so it's a lot simpler to carry out than most brush biopsies or other kind of biopsies. So it can be done in more like community-based clinics and be done in a large scale. It's also a lot more cost-effective. It ensures that there's a higher patient compliance since it's simpler and less invasive. So, like mentioned, there are some key salivary biomarkers that I like to talk about. So the first is like inflammatory mediators. These are associated with things like gingivitis and periodontal disease, things like interleukin 1. They're indicative of the inflammation that's going on in the mouth. Tiffany had also mentioned MMPs 8 and 9. So these are associated with the collagen breakdown that happens with periodontal disease once we start to see the bone recession or bone loss. And then another important thing is bacterial profiling. So with salivary diagnostics or testing, we can profile which kind of bacteria are most prevalent in our patient's mouth. So we can associate things like P. gingivalis or T. forsythia with periodontal disease or gingivitis, depending on what kind of bacteria is most prevalent in their mouth. And then there's also stress biomarkers that can be prevalent in our patient's oral cavity that can give us insight on the progression of the disease. Usually when there's more stress indicators, our patients are more involved with periodontal disease as it's a factor. And then lastly, DNA methylation patterns have revealed genetic changes associated to hidden disease, like Amy had mentioned. And then beyond the mouth, there's more to salivary testing than just it being associated to perio or gingivitis. Salivary testing can be used for things like RA, rheumatoid arthritis. So increased levels of like those inflammatory cytokines in the saliva can be associated with RA, and it makes it easier to detect, especially early on. And then IBD, inflammatory bowel disease, it can be also be detected with salivary testing, and it reveals elevated levels of C-reactive protein, which is an indicator for that systemic inflammation. And then, so these kind of findings kind of make a correlation between our overall health and our oral health. It shows how these can be linked. An example of this can be how the presence of P. gingivalis in our gut microbiome can be associated with IBD. And overall, salivary testing just makes a connection between what is going on with us, and it helps us make those diagnostics. And like Tiffany mentioned, there's definitely a future for salivary testing, and if incorporated and practiced properly, and could be a very, very valuable tool to help us diagnose and treat patients at a much better rate. Alrighty. Any questions at all for Tiffany or Amy or I? Are we all set?
Well, thank you so much for listening to us. I hope we gave good information on our Saliva Secrets, autoimmunity, and periodontal health.